peanuts. Peanuts are a high source of mold. And so I found out that it's important to get them dry roasted. And anyway, finding that out caught my interest, and I'm interested to hear, what other areas mold might be in that are affecting my health, and I don't even know it. My name's Evan, and I'm the pastor of the Kinston Seventh-day Adventist Church. The church is sponsoring this event today, so warm welcome from the church. Otherwise, we have Dr. Ryan here. He's presented before on blood sugar control. Learned some really cool things last time we did this. And when we end today, we're going to have a few free books for anyone that wants some, so grab that when you head out. But otherwise, I'll give it over to Dr. Ryan, and I want to thank you for being here today.
Well, good afternoon, everyone. I am glad that you're here today for an interesting and, in my opinion, an exciting topic. This is one of my favorite health topics. It's something that I personally work a lot with patients, but it's not something that many doctors work with a lot. Mold illness is a little bit of a different kind of condition, but it's very real. You're going to learn more in the next 45 minutes about mold than you've probably ever learned before. We're going to pack a lot of information in, and I'm excited to share. This is called A Holistic Approach to Mold and Mycotoxin Illness. I'm just going to start off a couple of fast facts you may not know about mold. Did you know, according to the EPA, 70% of buildings here in the United States have some degree of mold? Now, that might not be too shocking, some degree, because, you can have little amounts. But 47%, this was from 2017, 47% of homes in the United States had self-reported visible mold. So this was a survey that was done of a few thousand residents. Do you see mold in your home? About half of people said, yes, we see some mold visible in our homes. And the EPA has estimated that about 45 million homes in the United States have what is considered an unhealthy amount of mold in them. That's concerning. That's a lot of buildings, 45 million homes. Now, also, 85% of commercial and public buildings, so not private residential, but commercial and public buildings, about 85% of them have a history of water damage and mold exposure in those buildings. That's a lot. And when you think about it, it's possible that commercial and public spaces may not be as well taken care of as residential spaces, right? And so you see almost 90% of commercial spaces have a history of water damage and mold exposure. 93% of cases of chronic sinusitis can be attributed and linked back to mold exposure. A lot of people in our country have chronic sinusitis, and mold is often missed as the major originating cause of that. 4.6 million new cases of asthma and lung disease annually are attributable to mold exposure and mold illness. So, a couple of fast facts there at the beginning to get our attention about why this is an important topic. Now, for some of you, you've seen me before. For some of you, this might be the first time. Who am I? What am I doing here? My name is Ryan Turnowich. I'm a naturopathic and a functional medicine doctor. That's what I do. It's more of a holistic approach to care. I live in Jacksonville, North Carolina, and I work for a clinic that's based in Virginia Beach. It's where I used to live, but I do care for patients in Virginia and North Carolina in person and telemedicine. You can see a little bit about me there. I am also a Seventh-day Adventist Christian, and I'm grateful to the Kinston SDA Church for hosting this community education event. So that's a little bit about me. So in today's talk, we're going to learn a lot about mold. We're going to go through the different sections. Each section will be about 5 to 6 minutes each, and we're going to just learn some things. We're going to learn some more facts about mold. We're going to learn about mycotoxins. What are those? Well, we're going to learn about those. Those are the things that actually make us sick from mold. What does sickness from mold look like? Signs and symptoms of mold and mycotoxin illness. How do we test it? How can we even know if we have it? What is a little bit of an overview of treatment? And then we're going to talk at the last two sections. I think are the sections that will be the most practical. We're going to talk about buildings and mold exposure, and then 7 steps that we all can implement to prevent mold illness. So are we all excited to dive into this topic today? So the first one, some fuzzy and some fearsome facts about mold. Let's learn a little bit about mold. So, mold, as we know, this is a type of fungus. This is naturally present in the environment. Mold is all around us. It's always been around us. Anywhere you've got water, moisture, oxygen, and organic biodegradable matter, mold can grow. Those 3 things: water, moisture, and organic matter. We eat it, we touch it, we breathe it in every single day of our lives. Probably in this room right now, if you did an air sample, there's some mold spores everywhere we go. We have exposure to this. So this is not something that, our bodies are incapable of handling, but it's about the dose, right? How much are we going to be getting exposed to? There's about 100,000 known species of mold that have been identified by scientists. Every single one of those species requires moisture to grow. So that's something we're going to talk a lot about, water and moisture. Mold can grow on virtually anything that can harbor moisture. So here's some surfaces mold can grow on: dirt, soil, stone, wood, paper, carpet, tile, concrete, plants, food, insulation, drywall, roofing, any fabric, dust, and grease. All of those are biodegradable substances, materials, organic matter. You get a little bit of moisture, you get a little bit of dust, paper, wood, stone, whatever, mold can grow. Now, mold cannot easily grow on things like plastic, metal, glass, or fiberglass alone. Now, why do I say alone? Well, if the plastic or if the metal has dust on it, well, okay, the mold can grow on the dust. But just purely on the glass or metal alone, those are surfaces mold really doesn't grow on. They're not biodegradable surfaces. Now, the way that we build homes has pros and cons. We build homes where we sort of insulate everything. We kind of create a closed space. That's good for comfortable air and such, but it creates problems as far as the breathability of houses. And it allows for trapping of moisture in a lot of spaces. And the way that we build modern homes is causing opportunity for mold to grow in buildings. And we're going to learn a lot more about that. Now, mold's been around, and it's been a problem for human beings going back a long time. The first writings we see, different cultures started writing about mold as a health hazard dating back to the 14th century. For those of you here who are Christians, you might be interested to know that the Bible itself talks about mold. In Leviticus chapter 13 and 14, there's two big passages where the Bible's actually writing about mold found on fabrics and mold found in buildings. And the high priest of the Israelite nation at that time would call a building unclean if this greenish or reddish substance would grow along the walls of the building. It was mold. Also, they would talk about fabrics would be unclean if mold was growing in them. They would have to be burned if it was continuing to expand, or they'd have to be washed multiple times. The Bible goes in great detail about this in Leviticus 13 and 14. So interesting, mold's been around a while. And the other thing about mold is it's a very tenacious thing. Depending on sunlight, airflow, the nutrient availability, spores can survive up to decades. They can survive up to decades in certain environments. If you have a mold spore and it has enough, a little bit of water and a little bit of nutrient, even if it goes into a dormant state, it can survive for a long time. It's very resilient. And that's what makes mold a little bit hard to kill and why it's often undetected. A couple more facts about mold. This is interesting. Mold produces gases. When we think about mold, we mainly think, okay, we just see the visible mold. How does it make us sick? Well, as it's living its life cycle, its metabolism, it emits gases into the air. Those gases are what we breathe in and make us sick. Most of those gases are what we refer to as mycotoxins. Mycotoxins are the molecules that are just part of the life cycle of mold, but it protects it 1 square inch. Okay, so you've got your wall, you've got your basement wall, so you've got 1 square inch of mold, has 1 million mold spores in 1 square inch. 1 million mold spores. And those 1 million mold spores produce 500 million fragments of mold fragments into the air every single day. That is enough to fill about 2 to 7 balloons worth of air that is filled with mycotoxins from 1 square inch of mold. That's amazing. If you think about a quantity of 2 to 7 balloons worth of air from a little inch. So when we think about exposure to water-damaged buildings, our bodies are inundated. When you think about being in a space where you have a lot more than 1 square inch, you might have entire floors, walls, different spaces covered. This is where the body gets overwhelmed. And this is where we start to get sickness from mold because of this massive amount of exposure. And mold progressively makes us ill. The thing about this is, as we're in such environments, over time, we just slowly start to feel worse and worse, and we get these symptoms. And that's how mold illness is sort of this insidious thing. It's often missed, it's often misdiagnosed, but we're going to learn a lot about it today. So that's part one, a couple of facts about mold. Now we're going to talk a little bit more about those mycotoxins themselves, because when we discuss mycotoxin illness, these are the things that actually make us sick. So what are they? Well, we just mentioned they're the gases. They are the metabolites, meaning that they're the products of the life cycle, the metabolism of mold. and they're capable of producing disease and death in humans and animals. So these are the things that can make our bodies sick, can make our system sick. There's about 300 to 400 mycotoxins that have been identified so far. They're invisible, they're odorless, and they're gases. So we don't see them, we don't taste them, we don't know that they're there, really, because when you smell mold, you're not smelling mycotoxins, you're smelling the spores. They're invisible, odorless, and microscopic little molecules between 0.1 micron and 10 microns in size. And so every day we are inhaling them, we are ingesting them, we are absorbing them in our bodies without really knowing it because they're so tiny. Because mycotoxins are so small, they have the potential to go just about anywhere in the human body. And we can find them in our brains because they go through our blood-brain barrier, and our kidneys and our liver, everywhere, and including in pregnant moms, we know that mycotoxins can go right through the placental barrier into the baby. Here's some names. Some of you may not have ever heard of any of these names. These are the actual names of just a few of the mycotoxins: aflatoxins, citrinin, fumosins, gliotoxins, trichothecenes, lots of these different things. These are the molecules which I test and work with, so you can see some of these names. So that's some of the ones that we find. What do they do? When we have mycotoxins in the body, there we go, perfect, awesome. When we have mycotoxins in our body, there's different effects that happen. So this is how we can get sick as human beings when we have mycotoxin exposure. So we'll just take a look at this. You don't have to read every single line, but mycotoxins, they cause damage and inflammation in our sinuses, in our lungs, in our bladder tract, in our digestive tract. They cause damage to our brain, to our nerve cells, to our kidney cells. Mycotoxins cause damage to the little parts of our mitochondria and the energy-producing organelles in our cells. So we have damage to that area. Mycotoxins cause our immune system to be suppressed. So when we have mycotoxins, our levels of T cells and B cells and natural killer cells, all those healthy things that help us fight infection, mycotoxins bring all those levels down, which make us more susceptible to infection. Mycotoxins deplete a molecule we're going to talk a little bit about today called glutathione. It protects us. Mycotoxins make us more allergic and sensitive to things. So when we have increased allergies or sensitivities to foods or plants or other environmental things, a lot of people have a lot of allergies and a lot of sensitivities. Their immune system can't tolerate a lot of stuff. Mycotoxins increase the immune system sensitivity to different foods and plants and chemicals, including to even electromagnetic fields. They also start to break down the membranes in our gut, causing us to have permeability in our gut. And some mycotoxins are actually carcinogens. So these are, there's about 300 to 400 known mycotoxins, and they have a lot of effects in our body, which you can see then. This is how there can be a different amount of signs and symptoms. So we're going to transition to now, all right, we learned a little bit about mold. We've learned a little bit about, some of the nature of mold, nature of mycotoxins. What does it look like if a person has sickness from mold? Well, because we just looked at that list of all the potential cellular effects of mycotoxins, you might imagine there's actually quite a number of symptoms. Now, mold illness, unlike some other conditions, it can't be diagnosed with just any one symptom. Some conditions, you have a very clear distinguishing symptom, you've got this condition. That's not the way it works with mold illness, because mold mycotoxins can affect so many systems and they look different in different people. So due to many factors, our genetics, how we each detoxify differently, how healthy our immune systems are, how healthy our lifestyles are, two people can be in the same environment and have the same exposure to mycotoxins, but have different symptoms. And that's just because of the differences in how our bodies individually are able to process out and detoxify and manage the mycotoxins. So that's why mold impacts different people in different ways. There's a lot of different symptoms. Symptoms often from mold illness often begin very quiet. They're somewhat not noticeable at first, and as we're continuing to live in a space or be in a space where we're exposed to a lot of mold, those symptoms will over time get worse and worse and worse and exacerbate, and we're like, I'm not feeling well, I'm having all these different symptoms. Oftentimes it takes a few months. Let's say that you moved into a place, you started working in a place and you have a mold exposure. Generally 3 to 6 months after that exposure began is when a person starts to develop symptoms. So that's a little bit about it. So now that we sort of see that, we're going to go through some of the common symptoms of mycotoxin illness, of mold illness. There's a lot here. The first system that we definitely see has to do with the ears, the eyes, the nose, the throat, all of this situation up here. Okay, mold illness can cause a lot of sneezing, mucus, postnasal drip, chronic sinusitis, the nasal polyps, the swollen lymph nodes, the sore throat, increased allergies, increased hay fever, all of that. But tinnitus is super common with mold illness, popping in the ears, hearing loss. So you get a lot of symptoms up here, okay? That's when, mycotoxins, we tend to be breathing them in. They start irritating that system first. Respiratory, shortly thereafter. We start to get shortness of breath, coughing, a little bit of wheezing, increased asthma, some discomfort in our lungs. Some people actually have aspergillosis, which is where you start to get a fungal colonization in your lungs. Sensitivity to chemicals. You start realizing, I just can't, I start to feel ill if I start smelling, the perfumes or Febreze or the Tide. I'm getting a headache from this, like the sensitivity to chemicals. Chest heaviness and colds, this vulnerability. Every time I get sick, it goes straight to my lungs. Like my lungs are my weak spot. Like, so we see a sinus and a respiratory vulnerability for sure with mold. That's sort of the main area. The second main area is our brain. Mold brain is such a real symptom. I see it all the time. Brain fog, confusion, memory problems, difficulty putting words together, just difficulty linking thoughts, shortness of, it's a difficulty with thinking. The brain fog is super common. And we also know that mold impacts our nervous system at large, not just our brain, but our peripheral nervous system. So we start to get things like seizures or tremors, dizziness, coordination issues, walking, balance issues. Some people, headaches are very common. Headaches and brain fog and fatigue are very common symptoms of mold illness. Sometimes people start to develop an increased sensitivity to touches and noise. So again, that's that sensory hypersensitivity to senses or noise or smells. All of that we start to see with mold illness. Some of you might be seeing this list and saying, oh yeah, I resonate with some of these symptoms, but this isn't it. Mycotoxins do go throughout the body. They do affect our cardiovascular and our circulatory system. We start to see an increase of spider veins, of cheirogangiomas, little tiny blood spots on our skin. We see easy bruising, some changes in irregular heartbeat, Raynaud's phenomena, which is a combination of both the nervous system and the cardiovascular system, the blue fingers. That's worsened with mold exposure. A lot of people start to get itchiness on their skin, sensitivity on the skin. The whole body starts to become a little bit more sensitive and less tolerant to other things. So you start to get more rashes, more sensitivity, more burning. You're even more sensitive to sun sometimes, and a prevalence for fungal skin infections are called tinea or ringworm. So if people are having a mold prevalence inside, it's easier to start getting fungal infections elsewhere. So we see skin problems. Now, we saw earlier mycotoxins affect our gut, and we know that the GI membrane is another system that is impacted by mycotoxins. Oftentimes, folks start to get some digestive upset from that too. Irregular stools, some nausea, some vomiting is very common. IBS, sensitivities to food. Again, you're seeing this picture of sensitivities to increased sensitivities to other things in the outside world. Cravings for sugar is a very common symptom that we see a lot. And the bladder, the urinary tract is another system where mycotoxins can negatively affect that membrane, where we can have overactive irritable bladder, frequent urinary tract infections, or even blood in the urine. So a lot of symptoms that mycotoxins have the potential to cause. This is very common. I see this in most patients that have mold exposure. Mood changes. Mycotoxins do pass right through the blood-brain barrier. That's how they cause the brain fog and memory issues. That tends to also cause mood changes. People tend to feel a little bit more anxious. They're not as settled. They tend to have more irritability, irrational behavior, some anxiety and depression. And then this one, we always see the immune system does get more susceptible to other infections because we learned mycotoxins lower the levels of all of our immune cells. The more mycotoxins we have, our T cells, our B cells, our natural killer cells, all those go down. So what happens is we tend to seem to get sick more often. Colds take a little longer to clear. Viruses tend to be longer to clear. You never fully recover from a cold. You're always sort of just in some state of low-grade sickness. And then sometimes people have a difficult time overcoming other infections like Epstein-Barr virus or herpes infections. And so these are things we see in the immune system. We oftentimes see recurrent vaginal yeast problems, cycle irregularities. So there's more problems. And then there's a couple here that are a little bit more specific to mold, which are kind of unique symptoms, but they're very common in mycotoxin illness. Those are what we call ice pick headaches. It's very unique. It's where you get it's like a sharp shooting pain that comes out of nowhere very quickly in your head. You get a headache. It's just this fast, and then it comes and goes, and they move around, and also this sense of internal like electrical shock, where you have these weird wandering pains. That's common in mycotoxin illness as well. Feeling worse in humid environments. So if people have observed every time a thunderstorm comes or every time it's really humid, I just feel a little bit worse, then that also tends to be seen for people that are dealing with mold illness, as well as this, where if there's no treatment or improvement, let's say you've got someone with a bunch of, they have a bunch of symptoms, they've been doing what the doctor said to do, and they're just not getting better. In many cases, mold, it can be a reason for that. So that's a lot of symptoms that you can see mold has the potential to cause. The big ones are, of course, respiratory, sinus, headaches, brain fog, fatigue, nervous symptom, and mood changes are the most common ones. So how do you even keep track of that? So I see patients with mold illness a lot. This is where in my practice I use a questionnaire called the Mold Illness Questionnaire, which actually I have patients as we're treating them periodically fill this out, where we're tracking these different symptoms to see progress. It really takes a combination of an intake, really studying each individual's intake, their history of exposure, their symptoms, and then looking at testing to see how the mold illness is presenting for each individual patient. So that's part 3, signs and symptoms. How are we all doing so far? Are we doing good? Thumbs up. We got a couple. All right, good. So interesting stuff, right? Because I haven't heard much about mold illness before. So how do we even test this, right? Like, what does testing look like for mold and mycotoxin illness? Well, it's interesting. This is fun. I do a lot of this. So just like with the symptom, you can't diagnose mold illness with just any one symptom. There is also not a definitive diagnostic test. We're going to see there's some very good tests, but the diagnosis is really made through the combination of someone who's trained to know mold illness, interpret the tests and the exposure history to put the pieces together and say, this is what a person is having, to really marry all 3 of those. But we do have some very helpful tests, though. Some blood work and some urine testing that allow us to see, is this a problem for us? So for blood work, these are not labs that you often see run in most doctors' visits, but these are labs that can be run and are run, and they're very helpful. The single most helpful lab for mold illness from a blood work standpoint is a mold IgG antibody test. Some of you, I'm sure, have had antibody testing done before. This is testing where in your blood, you're just looking to see, has the immune system produced antibodies against some kind of a foreign molecule or pathogen. If it has, that demonstrates that your immune system has been exposed to whatever that foreign molecule or pathogen is. So you can do testing where you can do a panel to look for IgG antibodies, or your antibodies your immune system makes, against the different molds. I'm going to show you an example of that on the next screen. And that would show, are you exposed? Like literally, is your immune system encountering these in its environment? That's the first. Now, complete blood count, that's a very common lab that most of us get done on annual blood work. You do see things like your white blood cell counts, your neutrophils, your T and B cell counts. Remember, we learned that mycotoxins, especially at higher levels, lower those counts. So you can see that usually in a complete blood count. This is not, again, a rule. Just because you may have normal levels doesn't mean that mold's not a problem, but in more advanced cases, you tend to see depressed levels of those. Now, this next group of labs are also labs that can be run. These ones are not often run by doctors, but unless they're looking for chronic infections, complement proteins 3 and 4, natural killer cells, nuclear antibody, and total immunoglobulins. These are a bunch of tests that look at your immune system and how well it's functioning, how well it's responding to things. There's a certain presentation we often see in mold illness where complement proteins are elevated, natural killer cells are depleted, and ANA is elevated. That is often a dead giveaway that mycotoxins are a problem. Also, inflammatory markers. These are standard labs that check to see, is your immune system inflamed? Things like C-reactive protein or ESR. If those are very high, that shows your immune system is inflamed and it's engaged in something. So again, it's sort of looking at a group of labs to see, and looking at, again, at the history and symptoms and interpreting, is mold the cause? So these are the labs that are run for mold illness. Now here's an example of a LabCorp mold IgG. This was a patient I saw last week. This was a 16-year-old girl that I saw at the practice. And, she's been sick for several months, increasingly getting sick. No one's known what's wrong. We ran this lab on her, among others. And we saw that she has elevated markers of 13 out of the 14 most common household molds. So these are antibody markers. And so this is showing that her immune system is producing elevated levels of IgG antibodies in response to all of these different species of mold. That unequivocally shows she has a higher than healthy exposure. And then knowing mycotoxin, what they cause, having training in this, then we can put two and two together and say, okay, here's what your symptoms are, a large reason of why you're having a lot of these symptoms, and we're going to begin treatment. So this was just a fresh IgG panel I wanted to share with you. That's an example of that. Now, the next type of testing is urine testing. Urine testing to look for mycotoxins themselves. Remember, we talked about mycotoxins are the little molecules, the gaseous molecules that mold releases into the air. Those are the things that make us sick. You can measure those in urine. There's 3 labs, there's the functional medicine labs that can check mycotoxins in urine. It's an at-home urine collection. Mosaic, real-time and vibrant wellness, there's different degrees. You can see Mosaic checks 11 families, real-time 16, vibrant checks 31 families, but looking to see, are you excreting in your urine elevated levels of mycotoxins? Very informative. Here is a report from a patient I also saw last week with a urine test. So here's some of these names. I had that screen earlier about, showing the names of mycotoxins. You can see here, like in this patient's urine, how high the excretion of some of these markers. If it's coming out of your body, it got into your body and it's causing symptoms, right? So this is another way that we can track through testing the presentation. So essentially we have some blood work and we have some urine testing that can be very eye-opening to see, is mold illness the problem. Just out of curiosity, have any of you ever seen any of these tests before? No? Yeah. They're fascinating tests, and they're very confirmatory for a lot of people. All right, so that's part 4. We're moving along here. So now we're going to look at a treatment overview of mold illness. This itself could be an entire talk, but we're going to do an overview. And I'm going to essentially share the most fundamental steps that we see in treating mycotoxin illness. Now, a couple of points here I just want to share at the beginning of this section, and there's a reason for sharing this. If you have mold and mycotoxin illness, or if you think that you have mold and mycotoxin illness, it's highly advisable that you work with a doctor who knows how to treat that. And why do I say that? Because as you're going to see on the next slide, treating this successfully, it's a multi-month, multi-step process, and that's just very challenging to do by ourselves. So it's not really practical in most cases or realistic to try to fully treat when we have a mycotoxin infestation in our body. And so that's because there's a lot of variability. There are some principles, and I'm going to share the principles, but when the rubber meets the road, the treatment of mold illness for one patient may actually look very different than the treatment of mold illness for a different patient due to the differences between those patients, their comorbidities, their infections, their immune system, their detoxification pathways. So that's just, there's differences, and it's really helpful to work with someone to guide you through that process. And this is also something that is always true. Healing from mold illness is never a linear process in the sense that it is a steady upward progression. This is like with any chronic infection, healing from chronic Lyme disease, Epstein-Barr disease, chronic candida infections, or chronic mold. There's ups and downs along the way, but the general trajectory is up and it can be healed. So these are the 7 steps that, I went through a year-long course on mycotoxin illness training. These are essentially the 7 steps that we guide people through. Again, understanding that there's variation between these. Now, the first step is the most important, and that is and this is what we're going to spend a significant amount of time in the next section, identify and eliminate the source of exposure. It's the most important step because if we can get out of the unhealthy environment, then the body can begin to heal. But if we have mold or mycotoxin illness and we continue to be in an environment where we're being inundated by these mold spores, mold fragments, and mycotoxins, it is very challenging for the body to really heal in that kind of space. So the first thing is helping to identify and then eliminate as much as possible our exposure source to have avoidance to the mold. That's the first step. Then we want to essentially lead people through a process where we are preparing the foundations of health in preparation for later steps. What do I mean by that? Oftentimes, when we have mycotoxin illness, we have all these different symptoms. People aren't feeling well, and if you go too aggressive too soon, you'll make people feel even worse. So you want to sort of build a healing pathway, and that always begins by building healing routines, which is involved helping people have a good nutrition routine, a good sleep routine, a good movement routine, a good stress management routine, a good, things like gentle sauna and contrast hydrotherapy, things like that to start build a foundation of healthy routines upon which we're going to do more aggressive interventions later on. Then we start moving into protecting cells from mycotoxins and free radicals. This usually is the use of high-dose supplemental antioxidants and cell membrane support nutrients. Then the keystone portion of this treatment involves a detoxification phase where we lead people through generally a 2 to 3 month period of time where you're leading patients through a detoxification of their body using binders. And then the last category is some patients actually, this doesn't apply to all patients, but some patients actually have had mold colonize in their own body, in the sinuses or in the GI tract. If we are in an environment where we had enough exposure long enough, we can sometimes not just have external exposure to molds, mold can actually colonize internally, and then we have to treat that inside. And then we end by rebalancing the tissue. Generally, for a complete process to heal someone from mycotoxin illness, on the short end, that usually takes about 3 months. On the longer end, that can take up to a year. So you can see why I said on the previous slide, if this generally isn't something that you want to do alone, you generally want to partner with a practitioner to help you through this process. But the most important elements of this are always going to be, no matter what, as much as possible to leave the sick or toxic environment, no matter what it takes, because then as soon as we do that, our body does start to heal and it does start to clear the mycotoxins. Here's a few of the agents. Glutathione is the most important supplement to take, and there's a few others, milk thistle, binders like charcoal, NAC, and DHA. So I'm not going too heavy into this just because this is a little more individualized, but I wanted to give a little bit of an overview of a treatment process. Now, the last
where it's going to be a little more applicable in our day-to-day lives on how we learn some buildings and goals, and I said that's what we're all like animal wellness. Buildings and goals. So what are we talking about for more of the severity, the extent of what wellness be is a very real thing. Buildings are where it becomes a problem. So let's talk about what that looks like. Where is more current ability have we should be concerned and we should start paying attention to? Well, when we look at the very beginning of this talk, I said mold needs moisture, oxygen, and organic matter to grow. There's a lot of things in the house that are essential to that. Of course, almost most plants can grow in high or high humidity areas, but it takes new downers. And anywhere that's experiencing
These are the most common places, and I've seen this on tons of patient reports. I mean, I had a lot of people who've gone through the process of having their home looked at. You see these all the time. HVAC systems, ventilation ducts are very common sources for mold problems, and bathroom vents. Those are very common. Subflooring, I would say HVAC and ventilation systems and subflooring are probably the two most common places I've seen where mold has been a problem in buildings. Subflooring is not, it's essentially underneath, right, the surface you're walking on, kitchens and bathrooms. Under carpet. Carpet is a haven for a lot of mold. Behind drywall or behind walls where you have plumbing lines or you have water lines that could have leaks there. Behind any drywall that ever had exposure at any point in that building's history to flooding, that water could have come down or under, that is where there's very commonly mold. Behind wallboard, exterior wallboard around windows that were not properly sealed. I can think of two particular cases of patients that after looking at their whole house, it was a massive area of mold right around an exterior window that was simply when the structure was built, it wasn't properly sealed. Refrigerators, freezers, washers, or any machines that are using water behind, underneath, or around those sorts of appliances is another common space you see it. Also, behind furniture or shelving that's flush with the wall. So if you have a space in your house where you have a shelf or something that's up against that wall and it has not been moved for years and there is no airflow behind that wall, that is
common place, but oftentimes the backside of furniture, shelving. Cardboard boxes and used pictures are very common places. For the possible capital items and any point. Now, what is the look for? All of us need to know where the training are. Don't want, because you look for, we don't know what to know. What do we want to look for? Well, obviously, it goes down. We see any visible mold spots, that's of course a sign, obviously, that we have mold. On the surface. Now, mold can look like different things. They can be gray, they can be dark, they can be red, green can be different colors. Sometimes it can appear more fuzzy, other times it can appear more slimy, sometimes it looks like dust. All of us have probably seen mold on the surfaces because we usually see it the side. There's a condensation. You're noticing a wall or an outlet or a light switch or a window or a door.
Noticing condensation around that structure all the time, that's a very often a gateway. There could be mold behind or in and around that surface. Anywhere there's been a leak, if you have any evidence or any history of leaking pipes or appliances, that's creating a vulnerable place for mold. Also, something that's a very clear giveaway is if you have paint that's starting to peel or crack or bubble or warp. Oftentimes, mold can be growing behind that. So if you notice on your ceiling, on your walls, a little bit of cracking or peeling or bubbling paint, we often see that. Or staining or discoloration on walls, floors, or ceilings. That's another very clear sign there could be a mold problem. Or soft spots or warping or sagging floors or walls. If you're walking and you notice a depression in the floor, you see a little bit of sagging in the ceiling or a soft spot, that's oftentimes a sign there could be moisture and water damage and mold behind that structure. If you see carpet marks, furniture stains, including spots on AC filters are very common. Again, these are signs to look for. And obviously, if you have a musty or unpleasant smell, that's another thing to very much pay attention to. And finally, if there's a space that you go in and you notice, I feel worse in this space. Every time I go to the bedroom, every time I'm in this house, every time I'm in the basement, I feel worse there. That is a sign, oftentimes, that there can be mold. So these are things to look for, and hopefully reading through this list will give us all a little bit more of a trained eye on what we can look for in our houses where there can be a problem. Now, for testing, there's different ways to test. Not all mold tests are equal, but this can be done where we can do different types of analysis of mold testing. There's air testing, where you can have air samples that check for spores or fragments. There's ERMI testing that we can do ourselves. You can do dust samples and send them to a lab to look for mycotoxins. There's mold plates, mycotoxin tape, swab. There's even dogs that are trained to come in and smell out mold. There's canine mold testing, and there's moisture meters. This here is a residential moisture meter that I use. I bought this on Amazon, and it's super easy. Anybody can own this to go check your house or properties you may want to rent or buy. It's a great investment. You can get this at the hardware store. So for example, I can say wall, and I can hold this up to the wall right here, and I can see that has a 1% humidity on that wall, or a moisture reading. I can change it to soft wood. I can put it here. This has an 8.9% humidity. We're going to talk about humidity in the next section. A moisture meter is a great investment. You can go around your entire house. You can check your floors. You can check your walls. You can check your bathroom. You can check anywhere. And if you have spots where your moisture meter starts beeping high, that is oftentimes there could be moisture on the other side of that surface leading to mold. Generally, when we're testing a house, if we're going to do it thoroughly, you want to have samples collected from multiple different locations. So this is how testing is done. Now, some people say, well, can I do testing myself, or do we have to pay for a professional to come in? If you have a suspicion of a problem, now that you're learning, here's some things to see in a house, here's some, I got some suspicion about some, generally it's recommended to get a qualified, credentialed professional to test. Now, why do I say that? Well, and I've encountered this, having worked with, I don't know, hundreds of patients with mold illness, I have encountered a lot of cases where not all testing is the same, especially when there's involvements with either like apartment management or property managers, different things like that. Sometimes tests can be intentionally false negative, or a test can be done and it's a poor sample where it's just someone comes in and just grabbing an air sample from the middle of the air and they're not really doing anything else, and that can lead to a false negative. If you're going to have a tester, you want to have someone who's going to get multiple different, who do a combination testing approach. Who will do some air sample, some mycotoxin testing, some dust testing, some plate testing to really get a more thorough analysis and ideally someone with credentials. Here's a few examples of some certifications that mold inspectors can get that will make them more credentialed and more trustworthy. And when do we want to test? Well, we want to test if we've had water damage, we want to test. If you've had remediation, you definitely want to test after remediation. Was it done well? And if you're going to go buy a house, I do invest. If you're concerned, if you go and do with your trained eye an inspection of that house, and perhaps you might be a nerd and take your moisture meter in when you're looking at the house. But if you have a suspicion, you may want to have that house tested before if you really want to get a house. It's worth it to do that work up front rather than having to regret a situation later on. Now, a brief note here before we get to our last section about remediation. Let's say you had a building, there was a problem, you saw some signs, it was tested, and yes, we learned we got a mold problem in this building. And so now we learn, okay, this is why I'm starting to feel sick. And so remediation is necessary. It's important to have it done well. And this is where it's really worth working with a company that's going to do this well. Now, as a clinician that works with mold illness, there's a recommendation that's very strong. This is because it can worsen things. If a patient is actively mold sick themselves, they should not be doing remediation. Remediation stirs a lot of dust up. It stirs a lot of mold fragments, a lot of spores, a lot of mycotoxins. That should not be the person doing the remediation. If you yourself are mold sick, you should get out of that environment to let your body start to heal and have professionals start to do it. If you're pregnant, if you're nursing, if you're immune deficient, if you have cancer, kidney or liver disease, active respiratory disease, or if you're a young child, these are populations that shouldn't do remediation because it's the risk is too high of damage that can come to that. We want to get professionals to help with that. When there is remediation done, obviously there's a lot that could be said here. Just a couple of little points. Good remediation will have containment practices, meaning that the area where the mold has been grown will be properly sealed off so that there won't be airflow. There'll be negative airflow in that space that won't contaminate the rest of the space. The remediators themselves will have protective gear. Proper remediation is not what is called spraying and praying or painting it away. That's not remediation. We just spray something and wipe it down. If there's a big problem, proper remediation is to actually cut out or remove the moldy structure. Now, if we have little spots, we're going to talk about in the next section, a little small spot, that can be done at home. But if we have a significant problem, when in doubt, cut it out. It's worth it to remove the building materials, the boards, the drywall, whatever, to do it right once, to remediate properly once, rather than invest money into remediation, and then a year later you're sick again because it wasn't done well. A general rule is that a healthy margin is to cut 2 feet. If they have a visible area of mold, remove material 2 feet past that. And that's because a lot of mold is microscopic, and a lot of the spores you don't see, and a lot of the rhizomes you don't see. And so if oftentimes, this has happened so many times, people have remediated, but it wasn't done thoroughly enough, they've put the walls back up, the mold problem recurred. So it's worth it to do it right once, take your time. This is obviously something that, of course, you're working with a company, but just a couple of notes about remediation. All right, we're going to come to our final section here. How are we all doing it? Thumbs up, thumbs here, we're doing this nodding heads. All right, so I hope that you're enjoying this. You're learning a lot about molds. I know each one of these sections themselves we could go into more depth in, but I'm wanting to give an overall appreciation for mold and mycotoxin illness. All right, 7 steps for mold prevention. Probably all of us now don't want to have mold in our houses. I would imagine we don't want to have mold sickness because we've realized the severity of it. So these are some practical tools we can do. I want you all to learn the 5 enemies of mold. The 5 enemies of mold. Dryness, or essentially lack of moisture, lack of humidity, fresh air, sunshine, no dust, no clutter. Dryness, fresh air, sunshine, no dust, no clutter. Then I got a bonus, a couple of other enemies of mold here. But these are the things that are the antithesis of mold. So let's get into the 7 steps. And you feel free to take pictures or take notes if you want to do these. These are things all of us can do, all of us should do. We should tell our family members to do to prevent this potentially big problem from developing. Address in dry water fast. Mold can start growing within 24 to 48 hours after when water has encountered a new structure. So let's say you had a spill, a leak, a pipe break. Within 24 to 48 hours, mold can start growing. If you dry that surface within 24 to 48 hours, mold generally doesn't grow. So if you have new water from any source, dry it quickly. Get on top of that fast. You're going to prevent a bigger problem later on. So don't let water accumulate and stand anywhere. Wipe up spills, dry wet carpet, dry upholstery, dry laundry, dry floors. Check your plumbing. Make sure you're not having little leaks. Go around, inspect your pipes, inspect your leaks. If you have a leak, repair it quickly. Stay on top of that. Try to dry water fast. Something else is prevent frozen, but this isn't something as much down here. Of course, this week it applies. Where I'm from initially in Ohio, and certainly where I was before in Montana, it's very cold for a lot of the year. In the wintertime, there's a lot of times where if you don't open, so essentially if you have an out and like a spigot that goes outside of the house, if you seal that off, in the fall and you close it for the season, generally there's water inside that pipe that's going through the wall, and then when the temperature gets really cold, that water can freeze and crack open the pipe inside your wall. So the way you prevent that is going into your basement or in your house and doing a shut-off inside, essentially, that goes to that valve. Leave the valve open on the outside, let the water drain out. You won't have a crack in an interior wall. This has happened in many cases. People all they did was they closed their spigot in the fall and a piece of ice expanded big enough and cracked their pipe inside the wall from the wintertime. So you want to prevent frozen pipes from cracking. You want to check your plumbing. Roofs, this is a major issue. Roofs, are we checking our roofs? Are we checking our gutters? Gutters can sometimes get very overflown. They've got all kind of debris and grass and needles, and that's preventing good water drainage, which can lead to water buildup, and then water can start to seep into little cracks of buildings. So are we checking our roofs? Are we checking our gutters? Are we checking our appliances? Are we making sure that our washing machine and our dishwasher and our fridge and our toilets and our showers and our sinks aren't leaking? So this is what we want to do. We want to go around and look to see, do we have a water problem? This is a great thing to do. Go check the floors and the edges of your kitchen and your bathroom and your countertop. Check your grout lines and stuff. Seal them up again. Because we all know you're out of the shower, you're in the kitchen, water gets around. Little bits of water, though, right by the kitchen sink, constantly getting thrown in that little crack in the counter place or behind the wall. Months after months, you got a mold problem back there. We'll reseal those off. So, address and dry water fast. That's our first rule here of 7. If we got a leak, let's get on top of that within 24 to 48 hours. All right, ready for rule 2. Keep humidity low. This is one of the best rules, and it's so easily done. Did you know if your interior house humidity is under 50%, mold practically cannot grow? So you know what you can invest in? A hygrometer. Has anyone ever heard of a hygrometer? There we go. Amy knows a hygrometer. All right. These are devices that measure humidity. Right now, the temperature in this room is 71 degrees and the humidity is 20%. That's great. I bought a package of these for $8 on Amazon, and I got them stuck around our house. They measure humidity. Why do we want to measure humidity? Because if humidity, this has been looked at again and again. If your humidity is under 50%, mold's not going to grow. So you can check that. You can control your humidity of your environment. And it's super interesting because you can see, like, after you shower and you steam up the bathroom, it gets up to 70 to 80%. But then you have the windows open, you clear it out, it goes back down under. So buy a hygrometer, buy a few, go check out your house, inspect that. We can control the humidity of our homes. If you need to invest in a dehumidifier, it's worth it. Trust me. It's worth it to have a little bit extra on your electric bill to keep your humidity down than have a mold problem that will cost you $1,000 and thousands of dollars in remediation in a few years, and you get sick in the process. So dehumidifiers, if there's a space in our house, that it's a living space in particular, and you're noticing through your hygrometer that it's always above 60, 70% humidity, invest in a dehumidifier for that space. It's worth it. That will prevent, if you get it under 50%, mold cannot grow. This is also when we create humidity in our homes, we want to try to vent that out, right? So this is where bathroom fans are great, the fan above the stove, open windows, open doors. Now, this is something that has to do with the building of a house. Well, actually, that's on the next slide. Well, I'll just share it now. We want bathroom fans to be vented to the outside, not into the attic. And if it's into the attic, that's a problem because you're taking all that humidity from your bathroom that you do every single day you shower, and you're pumping all of that up into your attic that already is humid, and you're just putting more there, you're going to have a mold problem in the attic. So when you do a construction of a home, or you want to look at that, you want that pipe to be coming up to the roof and venting out to the outside world, that you're going to have proper airflow and you won't have a problem in your attic. So we want to have vents. That applies also for the dryer vent too. You want that to be going outside. So anytime that we're creating that, we want to be venting out humidity, run our fans. Also house plants. House plants are great. They increase more oxygen in the air. Some people have practically a botanical garden in their house, and that creates a lot of humidity. And so that's a lot. Just keep an eye on your house plants. That's not most of us, but they can increase a lot of humidity. And this is a super interesting little thing. Let's say you have a space where there's humidity, but you don't use it much. Having a bucket of charcoal draws moisture out of the air. So maybe you have a shed or something, or you have a place in your garage and it's more humid there, and you don't want to run a dehumidifier all the time. Literally go get some charcoal blocks, put them in a bucket that will constantly pull the moisture out of the air and have that humidity be lower. So our first rule is dry the water fast within 24 to 48 hours. Our second rule is keep humidity low, under 50%. Our third rule to prevent is let the fresh air flow. So mold does not grow when you have constant ventilation. Fresh, new air, mold cannot grow. Mold likes stagnant air. Mold likes stuck, stagnant, low humid air. So if we are opening our doors, opening our windows, running our ceiling and area fans, if we're moving air through our houses, that is a great deterrent for mold. So like I mentioned at the very beginning, the way that we build our houses now is so good. We seal them in, that's good, but it's also a problem. The EPA has done, this was also from a report that looked at the amount of airborne toxicants compared to the outside to the inside. The average American home is 2 to 5 times more toxic, the air indoors, than it is outdoors. And that's because we don't have enough air exchange often enough. Now, we can easily control that in our own homes. Open your windows, open your doors, let fresh air in. Get circulation going. Also, yes, vent appliance fans to the outside, not the attic. This is a big one. Furniture or boxes or shelves sitting flush with walls. Okay, how many of us have a space in your house where there's a couch, there's a shelf, there's a refrigerator, there's something, and it hasn't been moved in 20 years, and there's no airflow behind that shelf. There's no air moving. Very commonly, you pull that out, it's super common to see mold growing on the back of those surfaces. So when we're arranging a room, give a little space, a breathing room to your furniture, especially I guess around here. I don't know if this is far enough. I know there's no basements in Jacksonville. Are there basements in Kinston here? We're still too close to the coast? Okay. So no basements here. I'm from Ohio. Everybody has a basement in Ohio, and there's a lot of moisture in basements. And so, but you want to be careful about things being flush against walls. And be very careful with finished basements. Finished basements is where you're having all of the drywall up. The basements really need to breathe. So let the fresh air flow. All right, our fourth of our 7 mold prevention is to filter and clean our indoor air. This is great. Now, this isn't mandatory, but it's a great thing to do, especially if we have a suspicion, especially if we think of a little bit of a problem, we can filter our air. So mold spores are there's 100,000 species of mold, so there's different types of mold spores, but they range between 1 micron and 100 microns in their length. Mycotoxins, we learned there's 300 to 400 mycotoxins. They go from 0.1 microns up to 10 microns in size. Okay, pretty small. So we're thinking about particulate size. Now, some of you here that have worked, in the contracting industry, you're going to be familiar with air filters and their ability to filter particles based on size. All of us have air conditioners. All of your air conditioners have filters that go into those air conditioners. And every filter that goes on every air conditioner has a MERV rating, 1 to 20. How many of you have ever seen the MERV rating on AC filters, right? Okay, we've seen a couple here. The lower numbers, 1, that filter is not capturing much. It's pretty much letting most through. 20 is getting all the way up to things as small as 0.3 microns in size. Now, every HVAC system, an HVAC system is built to be able to have it's rated to be able to go up to a certain MERV rating. You want to find that out, and you want to get the filter that's the highest number your HVAC system can use, because that means it's going to filter air to the smallest particulate size possible for that system. Some systems, a lot of them don't go all the way up to 20 because the filter is so tight, there's actually not a lot of airflow. But most AC systems can do MERVs 10 through 15. And that's going to get all mold spores. It won't get mycotoxins, but it'll get all mold spores between, if you go to 12, 13, 14, 15 range. So for your AC filters, you can start going to Lowe's or Home Depot or Ace or whatever and looking at this thing and saying, I want a MERV 15, I want a MERV 14. You're going to start filtering your circulating air, preventing some mold. You also want to change those out. Like, you don't want to let those sit in there just forever and ever, because that is a problem. So at least every 3 months. This also applies to car filters too. I've had many patients where mold has grown in their cars, and the car cabin filter has been a problem. You want to change that out. Now, there are portable filters. There's a lot of personal use air filters that people can buy. Not all of them, most of them in fact, are not rated to get mycotoxins because they're so tiny. There are some companies that are. These 5 companies are all rated down to the 0.1 micron level. So these are air filters that if you wanted to buy for your bedroom or your office or something that you spend a lot of time in, it will actually filter mycotoxins out of the air. Austin Air, EnviroCleanse, and Air Oasis are amazing brands of portable room air filters that you can purchase. So our first rule was, right, dry the water. Second rule, keep humidity low. Third rule, let the fresh air flow. Our fourth rule, filter and clean our air. We got 7 rules. 5, clean, dust, and declutter. Okay? Why do we want to do this? Because mold grows on dust. Dust is organic, biodegradable material. Mold loves dust, in fact. So if dust is on any surface, mold can grow on that surface. The more dust you have, the more opportunities you have for mold to grow. So the more surfaces we have, we're creating that. So there is a legitimate benefit. This has been seen repeatedly, where there are the more material things we have in a house, there's more opportunity and oftentimes more mold problems that are occurring in that house. Oftentimes because things aren't being touched, there's worse airflow, there's a lot of dust accumulation, there's moisture accumulation, and mold starts growing. So we want to dust, we want to clean, and we want to declutter. We want to think about, do we have piles of things that haven't been looked at in years, that have a lot of dust and there's been no airflow? That's those areas that we want to be thinking of. It's a habitat, an opportunity for mold to grow, from what we've learned today. So this is our 5th rule. We want to think about just keeping our houses clean, really. Putting knickknacks behind glass, put things in cabinets, vacuum often. Don't forget about vacuuming, like even the tops of the furniture, the ceiling fan things, the doorways, windowsills. This is our 5th rule. So we got our 5th rule. We got 2 more rules here to have mold prevention. Our 6th rule is limit carpet and cardboard. Carpet and cardboard really are mold havens. Mold really likes to grow in these spaces a lot, especially if there's moisture, because these materials, by their very nature, harbor and hold onto moisture very easily, especially the padding underneath carpet. So if we have old carpet that's been in a house for a long time, and there's perhaps a history of water damage or water exposure to that carpet, I cannot even tell you the number of patients that have told me they've had a mold problem, we've been working through mold sickness, they pulled up the carpet, underneath that carpet and on that subfloor, total cover of mold. I've heard that so many times from patients. And so we know that carpet is a haven for mold. And of course, if we're not cleaning it, if we're not dusting it, if there's not good airflow, if there's high humidity, we are learning from today's talk, all of these things are risk factors for it to be a problem. It's good to clean carpet, you want to aggressively dry it and get that dry within how many hours? 24 to 48 hours, right? Because we know if you stop moisture in that, mold's not going to grow if you get it dry. So I'm not saying don't clean carpet, but don't let it just have fans on it to accelerate the drying as well. Area rugs are easier. Let's say, rather than having wall-to-wall carpet, having an area rug that you can take out, you can shake, you can clean, that you can hang on the shower bar from time to time. That's better than carpet. So think about carpet. Now, this doesn't mean that every single piece of carpet has to be pulled out, obviously, right? If you are controlling your humidity in your house, like we've talked about, if you're cleaning, then that's fine. Our house has carpet. We have rooms where I've got the little hygrometer. I'm not worried at all about mold there because, the humidity is 20%. It's good. So, but it's just, some of you might be thinking about some vulnerable spaces from what we've learned today. Cardboard is also a haven for mold. Cardboard holds on to moisture. Cardboard is so biodegradable. So, cardboard is used a lot. We use it a lot for storage in basements or attics or different places. That's a very common place. And again, especially when you have cardboard on a wall, it's a vulnerable wall. A vulnerable wall would be an exterior wall, a wall with plumbing, or a wall where there's been a history of water exposure. Then that's a concern. So oftentimes cardboard will be a problem. Keep cardboard up on higher floors, like the 2nd floor, the 3rd floor, or on shelves. Get it off the floor, have airflow around it. Consider using plastic containers for some of those more spaces. So limit cardboard and carpet. And our 7th Our seventh rule is for spots. Okay, now, you already heard me talk about buildings, you've already heard me talk about remediation at large. When there's a real big problem, don't do it yourself. Have a professional remediation done. We already talked about that. But what about you start to see a little bit of a problem coming? Okay, you're learning some tools. You're going to start changing your environment. You're going to keep humidity down. We'll drop your all this stuff. You can't, and you're also not mold sick yourself. There are ways to safely do essentially spot treatment for mold. Now, obviously, you can go to Lowe's and Home Depot and buy some very high, potent, toxic, effective but toxic chemicals for mold. You can do that, but also you can actually do spot treatment with some home items very effectively. And so the main thing is a lot of people would think about it as bleach. I don't know where that came from historically, but that's ingrained bleach for mold. But you go talk to any mold inspector, you take any mold literacy course, bleach is not the best thing to use. Bleach is mainly water. The bleach will kill the surface spores. It doesn't do anything for the underneath spores or the roots, and all the water actually feeds the mold. And in fact, bleach irritates the mold, makes it increase mycotoxin release. So bleach is not the thing that you want to use to kill mold. Undiluted white vinegar is very effective. Undiluted white vinegar is very effective for porous surfaces, which would include walls or drywall with little micropores. You get undiluted white vinegar, you spray that on, you let it sit for an hour, you rinse it off with water, you spray it on, you let it sit for an hour again, you dry it off. That will kill, it does kill areas of mold. Undiluted hydrogen peroxide, it does the same thing. Greater than 3% concentration. So when you go to the store, usually you get 3%, usually I think it's 12 or 17%. You want to get a higher concentration of hydrogen peroxide, undiluted, put it in a spray bottle, spray it on, let it sit 10 to 20 minutes. You can scrub it off, you can spray it again or dry the area, and then that will take care of it. There's also some very effective, and these are some things that I use in the treatment. We use a lot of these, especially for internal usages, especially for sinus colonization. But there's essential oils that are antifungal. There's some ones: tea tree powder, arco, basil, thyme, oil of oregano, olive leaf. You can put essential oils in combination with half a cup of water. You can spray it. You can let it sit on that area for an hour. Wipe it away. That will also very effectively kill the area. Let's say you have a stain. If there's a little spot and you've killed, let's say you've got a little area of mold, you've used your baking soda, your vinegar, or your essential oils, or maybe a combination of those, you've killed it, but there's a stain left on that surface now. This is where, of course, good old baking soda and water is amazing to just absorb the stain out as well. These are some of the agents that are a little bit less. Let's say you want to go buy a product and you don't want to get the super toxic stuff. These are four that are lower in toxicity: Benefact, CitraSafe, Microbalance. Chloroquine is okay, but all of these work though. So these are a few different brands. So a couple of things for spots. So for our summary here, the 5 enemies of mold that we've talked about, right? We have our dry environment, our low humidity, our low moisture, our fresh circulating air, sunlight. I didn't talk a lot about sunlight, but that's because it's a little bit hard to get sunlight inside the house. Sunlight kills mold. It's amazing. So anywhere you can get sunlight, it's great. If you have, let's say you have, I don't know, a shelf or something that got a little mold on it, take it out in the sunlight, do the treatment, and let it sit out in the sunlight for a while. Sunlight's very effective at killing mold. No dust, lack of clutter, those are our 5 enemies. And then our 7 mold prevention steps are to address and dry the water fast, keep humidity low, under 50%. That's where we can have our hygrometers. Let the fresh air flow, have good circulation, filter our air, dust, declutter, clean, limit our carpet and cardboard, and then use the vinegar, H2O, and essential oils. So that's our talk. I know it's been a lot. We've talked about mold, mycotoxins, signs and symptoms, testing, treatment overview, and now the 7 steps. Thank you all for hanging in there. Now you're going to go home and look like that guy. But I hope this has been informative for all of you and educational, and I'm happy to hear any questions that you may have on our mold and mycotoxin talk. So thank you. Yes, sir.
I got a question. About the mold, under any type of temperature, down, whether it's down or just and we got mold and mold pool, and then anything that is close to like with it also change if the kids down with mold or with the mold.
So you're asking like temperature and mold, right? That's a great question, actually. And so temperature, mold, that, yes, actually, it's a great question. Mold can grow at lower temperatures if humidity is high. Different types of mold. Mold tends to grow when the temperature is warmer, mainly just because there's more humidity. So for example, like, here in the summertime where like it's 80, 90 degrees, with humidity is higher, it's about the humidity. So mold can still grow in humid environments when the temperature is lower. However, it's harder to have humid air at lower temperature just based on the way air works. So mold is not as responsive to temperature as it is to the humidity. Now, when you get really cold temperatures, though, what often happens for molds is it goes into a dormant state. And then it's where the spores just become dormant and they wait for a long time, up to decades, if there's enough, a little bit of nutrition for them, to start growing and multiplying again if the environment becomes more favorable. So that's generally what happens is mold does become less active. At times, for example, the last couple of weeks, a lot of nights been 20, 30 degrees around here. Yeah, there's not a lot of mold activity at that time compared to the summer. And I've even noticed, like just in our house alone, the last couple of months, the standing humidity is at least 10 to 20% lower than it is in, for example, May and April, just by virtue of the greater environment, right? So yeah, there's less activity at lower temperatures, but the main thing is more humidity than temperature, if that makes sense. So, awesome. Yes, ma'am.
Someone has a lot of allergies.
Yes.
The person, I would be determined if this is maybe the problem, I would agree with our help.
Yeah, so how would I determine that? Well, so when I see patients, I go through a whole history. I ask very thoroughly all about the history of the presenting complaint. We'll go through a history of the allergies, when did they begin, what makes them worse, what makes them better. I always ask every patient about environmental exposures. I go through a list of things, like if there's a suspicion about mold. If I'm getting a suspicion based on that, and I'm seeing a link, okay, well, these allergies have gotten worse in the last 5 years. This person moved to this home in the last 5 or 6 years. There's a couple of questionable things about this home or this workplace or this office work. Then you're kind of putting the pieces together. That's where the next step that I would do, is to initiate some testing to confirm it, and then to start working on steps to start working on some of the treatment steps and mitigation steps. So, a lot of the information I shared today, I started sharing with patients about let's start doing some trained eye but self-inspections of our houses. Let's consider some professional testing. A lot of people already sort of have a suspicion. Probably some of you here, just hearing me talk, are probably thinking about some spaces in your house you may have a suspicion about. So, you're going through all of that. And then the treatments, depending on a person's vitality, their health, other factors, I can start treatment intervention at different points. So for allergies, there's a lot of things. There's mast cell stabilizers, there's different things. But that would sort of be, I don't know if that's helpful, that's sort of like the process of workup. Not everybody's allergies will be attributable to mold exposure. Many people's are, though. Many people have had an allergy that then has been exacerbated because they've had mold exposure. So, yeah. Is that at all helpful? Okay, thank you. Yes, sir.
Okay, so say I'm feeling, I got the symptoms.
Yeah.
Mold or and my mycotoxin illness.
Mm-hmm.
And I go to the hospital or whatever. From my urine test, say I take a urine test, will they be able to tell right away if I got it, or do I have to go in there and say, hey, I might have been exposed to mold, or from that urine test they would be able to tell if I've been exposed?
Well, it depends on the test. There's a lot of urine tests that are done. So there are, as I shared, there are urine tests that do look for mycotoxins. That depends, I would say that depends on the kind of clinic you're going to. So it's an interesting thing about mold illness. So, in my world of healthcare, in the naturopathic and functional medicine space, I work a lot with this. It's not as, it's not as commonly discussed or treated in more conventional healthcare establishments. Some doctors are more familiar than others. If you have a suspicion, you certainly should initiate, say, I'd like to get testing done, blood work. They may or may not be able to offer urine testing. That depends on the facility. Some will, some won't. Some providers will be familiar with mycotoxin testing. Some providers won't be familiar with mycotoxin testing. But that's where a lot of times, for example, a lot of patients will find a provider. Like I have patients that are seen from Maryland to Georgia for mold because they found us online. We're doing video calls because it's okay. Now I want to work with someone that can help guide through a process for mold healing, right? So then it's if you really think you have that's why I sort of said in that section. If you really think you have mycotoxin illness, there's some steps to immediately start taking, working on getting the environment, getting out of the environment, starting to minimize the mold in the environment, getting some testing done, starting things like the glutathione right away. But if it's truly if you're really sick with it, then it would be worth it to find a provider who's trained in that to help guide through the process, just because not all providers are, if that makes sense. So, and I know, and that's maybe a challenging answer, but it's just, for many people, they've been struggling with symptoms from mold illness and it's gotten missed. And they've been to doctors and no one's ever brought it up, no one's ever treated it, and they're still not feeling better until it was eventually learned, wow, here's what I have, and then they start a process of healing, and then finally you start to get better. So, yeah. Yes.
So to kind of testify to what you're saying about the whole, it could be your environment, because when me and my wife were at our old apartment, we didn't have a window in our bathroom, so it was kind of sheltered in, and my wife kept having this, she couldn't breathe, she just had this problem for months, where what's happening is getting worse and worse and worse, and we were thinking it was our cats, or we were thinking we had mold in our bathroom.
Yeah.
We would try to clean it and all that, but it would just keep
It would come back.
And then so it was just so bad. She was like, at night she just could not sleep. And so now that we moved our apartment into our house now, that totally is gone because we have a window in our bathroom. We're
Absolutely
really focusing on. So it's just interesting how you just kind of mentioned how just even you being in that area.
It's the best thing. Avoidance, changing the environment, because the body will start, if you get out of the mold environment, your body will start, even if you did no treatment, obviously a lot of people benefit from treatment, just getting out of the environment, your body starts the process of starting to clear the mycotoxins, and then if you compound that with things like, a lot of fiber in your diet, healthy, nutritious meals, doing some sauna therapy, some antioxidants, like you start accelerating that clearance, your body will start to go. I've many people the week after leaving, like within days after leaving an environment, they start, I feel a little better, more energy, my headaches aren't as bad, my brain fog, just because you're less inundated. Remember, in one of the earlier slides, 1 square inch of mold every day can produce 2 to 7 balloons worth full of mycotoxin-rich air. And so that's a lot. We're breathing that in, especially if we're in a little small apartment or something. And after months and years of that, that's where our body is inundated, and it can't heal, but we get out of that, then you can start to heal. And then if you can partner with a doctor to really help in that process, then you can really start to heal, And so yeah, changing the avoidance is really a great step. So, any other questions? Yes.
Is there a humidity level that is too low to be healthy for the normal environment?
Well, that is a very good question. Very good. I would say probably under 10 to 15%. I don't definitively we want to have we need to have a little bit of humidity for example, like the air, there needs to be a little bit of water just for the gas exchange in our alveoli. If you're getting under 10%, then that would be very, very, very dry air. So that would be, I want to confirm that, but that would be my thought. Yeah. Yes. The hygrometer? Yes, they're great. So that's a great question, Kim. So if we go back, so if we look at this, mold starts to thrive above 60%. But again, it's like, for example, right? Like I've got one of these in our bathroom. So after a shower, it could be, sometimes depending on the length of the showers, it could be up to 90% in the bathroom. Does that mean all of a sudden mold's just going to go over? No. Again, it takes 24 to 48 hours for new water exposure on a biodegradable material for mold to start colonizing and growing. So we're thinking about, do we have spaces that are chronically high humid, right? Do you have a room, a bedroom, a side room, a garden room, your shed, your garage, I don't know, that is always at 75 and 80% humidity? That's what we start thinking about. And then for the spaces that we know we temporarily increase humidity, Like here, when creating humidity in showers and cooking, and you're making pasta, you've got the dishwasher running, just vent it out. You know, have the fan running, just vent it out, and then in 20 minutes and 30 minutes, you're back out. There's nothing to worry about that. Again, it takes time. A chronic environment, and mold needs moisture, organic matter, and well, yeah, that's really it, moisture and organic matter to grow, and humidity, typically above 60%. If there's an environment where that is existing for a long time, that can occur. Now, the problem for a lot of the things I talked about in buildings are, of course, in spaces where you can't control the environment, underneath the floor, behind the wall. I mean, obviously, like no one has a humidifier behind the wall, right? So that's often where there could be, that's where we need remediation. If the building has had a problem, there was a leak, you got a second floor bathroom, and there was a water leak up there, and it got down, and it's now you look at your dining room, it's underneath the bath, a couple little stains there, and a little stain over here, and gosh, I feel really sick in this house. Well, that could be, there could be a whole mold situation behind that that's permeating through the mycotoxins, and so that, of course, that's where remediation comes into play. But we can control our spaces, our living spaces, through the hygrometers and things like the dehumidifiers and stuff. So hopefully that helps a little bit. So.
How can you keep the blueberries in the refrigerator from molding?
How can you keep the blueberries in the fridge without molding? That's a great question. It's interesting actually. There's a way. So if you wash your fruit, that's a great question now. So if you get your fruit, your strawberries or your berries, you get them from the store, you wash them, you do like a baking soda, and you put them in water and baking soda, that pulls all the pesticides and herbicides off, and then you do a vinegar spray on them, and then you let them dry on a paper towel after that, before you put them in the fridge. Then you put them in the fridge in a container and they're dry. They will last for an unbelievably long amount of time without molding. It's incredible. Because really, you've stripped off all of the dirt, all the things, all the pesticides, the baking soda, the vinegar, a little bit again, and the vinegar, once it dries off, it doesn't affect the taste of them anymore. You can get fruit to last a long time that way, actually. So.
I found that out about a couple of weeks. I was running a special.
Oh, yeah.
They had a small, and it was pretty good price. So, two of them for $4. And hard to find that.
Yes.
I bought some and I was eating them.
Yes.
The other day I opened
and it's moldy. Yes. Well, so for two reasons, for produce, I definitely you want to wash your produce, especially berries and thinly membrane produce like that. And it's great, a lot of the fruit and veggie washes, they're okay. Doing a baking soda soak, just water, putting a bunch of baking soda, letting it sit in there for a good 10, 15 minutes, it strips all of those pesticides off. A fresh rinse, a little vinegar, the produce is clean, it will last for a long time. The berries will last for probably at least 2 full weeks by that point. So.
I tried that with strawberries.
Yes.
My fresh strawberries, they're looking good.
Yes.
And you go and wash them and put them in baking soda. And you see some worms coming out.
Yeah, sometimes you do. Sometimes you do. I know. Same thing with broccoli too. You get a little green one. Yeah. Yes.
When you said the spray with vinegar, distilled vinegar, and do you wash it after, or is it safe to eat?
Oh, you mean the fruits? Oh, the fruits.
You said put vinegar and then store it.
Well, yeah, so you can spray it and then you just let it dry. I mean, you can rinse it if you want, or you can just let the vinegar dry. It will honestly mostly evaporate off. But you could, if you wanted to rinse it again and let it dry. The main thing is to prevent the mold before you put it in the fridge, to let the produce dry, like on a paper towel, and then it's clean and it's dry. Then it's not going to. If you put it in and there's a little bit of moisture, then you can get it mold. So, yeah. So. All right. Yes.
Are there a few general foods or anything that we should look out for that are generally high in mold?
That's a great question. And that was one, as I was preparing this talk, I had a lot of content. I was like, should I put a section in about food and mold? And I ended up not doing it, but maybe when I do the talk again, I'll do that. Yes, there certainly are. So there are. Mycotoxins, we eat them, we also breathe them in. Most people get mold sick from water damaged buildings. because water damaged buildings is what inundates our body with a lot of mycotoxins. So for most people, so if you aren't mold sick, if you've got a good environment, should you avoid all foods that have mycotoxins? In my opinion, you don't have to unless you have something else going on. It's like inflammatory, or maybe you're maybe having an individual food sensitivity. For patients who have mold sickness, who have symptoms of that, and we're treating that, then I absolutely do remove a list of foods that are high in mycotoxins. So the list would be, so peanuts is on that list, stored grains, which grains, when they're harvested, in the plains of this country, they are put in these big silos, and they sit there for a long time, and then they get sent off to wherever company they get sent off to for, to be turned into food. There's a lot of molds, particularly Fusarium and Aspergillus types of molds that will grow, and there's mycotoxins. So everything from oats, barley, corn, wheat, sorghum. I mean, most grains, honestly. Now, grains are nutritious. Whole grains have a lot of benefits. So I'm not saying you shouldn't eat grains, but corn, has a higher degree of a lot of corn has mycotoxins in it. Bulgur wheat can sometimes have mycotoxins in it. Things like any sort of, oh my goodness, I'm having a brain freeze. The preserved fruit foods like, what is it? I'm forgetting the name of it. So you have like, it's not ferment. Well, yes, obviously fermented foods, but there's another like the preserved that have been like the dried fruits and things like that. And those oftentimes have little bits of mold on them. Baker's yeast will have a lot of mold in it. Obviously, cheeses generally need mold to grow. Cheeses can have mycotoxins in them. So these are some of the things we think about. Soy sauce can sometimes have mold in it. Coffee is a major issue for mold. A lot of companies will certify they have mold-free coffee. That's actually another thing. I didn't even get into that. Sometimes it's not your building, it's an appliance that you use. I've had patients where it's been their coffee machine, their CPAP machine, their water filter that has had a ton of mold in it, and they've been drinking fluids, or putting their CPAP into a thing and the tube has mold in it. So sometimes you get mold in appliances that you use that have moisture that go through them. So those are some things. Yes, sir.
You're talking about grains.
Yes.
Shroud food, in solid.
Yes.
You test it, and you take it out of the truck.
Okay.
You do a test on it.
Okay.
You test the moisture.
Okay, good.
They also document the moisture. As far as what it is.
Okay.
It's hanging around 2 days, and then immediately when it goes in there, they have to turn all the fans on, and air and dries the grain out.
Good.
To get it below 17% moisture.
Good.
That way you don't have a great problem.
That's so good.
And it depends on what animal you're gonna feed it to.
Yeah.
Hogs, it doesn't really matter very much.
Feed mold, yeah.
Turkeys is probably the easiest animal to kill your eaters.
Wow.
And next to that would be a chicken.
Wow.
So that's where a lot of your problems come in with some of these diseases they have.
Mm.
Because your birds are far more susceptible to such as that than, let's say, cattle, hogs, goats.
That's super interesting. Wow.
That's all it could do.
Yeah. Yeah, that's interesting. So, thank you.
What about potatoes? Because I heard, I think I read somewhere where you leave potatoes out and it get molded, that it could be highly toxic too.
If you leave them, true. If you leave them out and you let them spoil. I mean, a lot of foods, if you leave them out and let them spoil, that it can be. Generally, though, if you eat potatoes in a reasonable time of buying them and you're not seeing signs of spoilage, then there's not going to be generally an issue with potatoes in most cases. So,
There's a very good thing with potatoes.
okay.
If you get a potato, and you leave it on the counter, if you see it start to sprout, throw it away.
Yeah.
Because that's what testing science starts.
Mm-hmm. Yeah. So once it starts, yeah. But if you eat it before that, then it's
Right, as long as it's dry and it has not sprouted,
right.
if it starts to sprout, throw it away.
Okay. Good advice. All right. Interesting. All righty. Well, I hope this has been informative. So, who learned something valuable about mold today that you didn't know? All right, we got all the hands up. I love it. Well, thank you again for your attention. I hope this was a blessing to you all. I'm grateful for the Kinston SDA Church to host these educational seminars, and we'll continue to do this. And if you have friends, that you think would benefit from these health talks, invite them to our next one. So we'll be able to share more with others. So thank you all.
Yeah, thank you, Dr. Ryan. Learned some new things today, and we're definitely going to be mold-proofing the house, making it better. Before we head out, just want to let you know we have a few free books over there. They're on general health. Anyone can take one if they want. With that said, hope you all have a good weekend. Take care.